cross-link between lysine and its aldehyde derivative, that is allicin. Very extensive cross-linking, and that gives the special tensile strength to the mature collagen fiber. And there are hydrogen bonds which also have a stabilizing effect. You see procollagen chains and see propeptide, their initiation of triple helical formation, and now the C proteinase and N proteinase cleaves the propeptides and collagen and then fibrils, and you see there is a 3/4 overlapping of the each of the collagen fiber. Now see what are the principal features of triple helix, and you have to remember all of these. There are 5 points. Number 1, individual alpha chain is having tight left-handed helix, and this is favored by the proline residue which is having a ring structure and a big amino acid, and which introduces a sharp bend in that polypeptide chain. Number 2, these all three intertwined alpha chains which form super helix, that is triple helix, is with right-handed chains. You see, single is left-handed, the super helix, triple helical structure is right-handed. So that is why the tropocollagen very resistant to unwinding by any tension. Now come to the point number 3, that is glycine, which permits close contact, being the smallest amino acid residue, and which is placed at the when all the three chains are come all together. Number 4 is the peptide bonds, which are internal because the side chains are on the outer side, and that is why collagen is very resistant to digestion by proteases. And number 5, the hydrogen bonds between the peptide bonds of different chains again stabilizes the triple helix and give them strength. Now come to the degradation of collagen. Normal collagen is a stable molecule, but there is constant and slow turnover. Half-life of a collagen molecule is months to years. And what happens? Degradation takes place during normal growth and development, or when there is tissue injury and tissue repair. And the enzyme which degrades the collagen is the collagenase, which is zinc containing metalloenzyme, and an extracellular proteinase. What it does, it splits the single glycine and isoleucine bond in each of the 3 tropocollagen, forming 2 large fragments which are spontaneously denatured, and now they are susceptible to attack by any intracellular proteases. That is, the main proteases are cathepsin, which converts them into peptides. So when the collagen fiber is denatured, then it is degraded. If there is native collagen, which is the resistant to most of the proteinases. Now when the collagen becomes old, there is the cross linkages are increased in numbers, and that is why skin, blood vessels and other tissues become less elastic and more stiff in old age, and that contributes the problems of old age. One more point, there is a bacteria, Clostridium histolyticum, which is the causative organism for gas gangrene, which produces collagenase, which splits each polypeptide chain, destroying connective tissue, and that is why it shows very much invasiveness. And again, the degradation of collagen fibers are seen in the cases of osteoporosis, tumor metastasis, rheumatoid arthritis, osteoarthritis, and so on many other diseases. You see skin aging, young skin and old skin. That is the major difference. Now come to the genetic defects of collagen biosynthesis and metabolism. So the collagenopathy is when the genetic defect, and collagen disease when there is a deficiency of any molecule. There are 9 diseases we have enlisted here from 1 to 6. These are genetic defects, and from 7 to 9 these are deficiency diseases. Ehlers-Danlos syndrome, osteogenesis imperfecta, homocystinuria, epidermolysis bullosa, dermatoparesis, Marfan's syndrome. These are all genetic defects and come under the heading of collagenopathies. And deficiency of ascorbic acid, lathyrism, Menkes syndrome, which is where the deficiency of copper, all come to the collagen diseases. Ehlers-Danlos syndrome, that is EDS, heterogeneous group, generalized connective tissue disorder, and there is certain defects in the metabolism of fibrillar collagen molecules. There may be deficiency of lysyl hydroxylase enzyme or pro-collagen peptidases. There may be mutation in the amino acid sequence of collagen type 1, 3 and 5. And there may be X-linked recessive deficiency of lysyl oxidase enzyme that results in the impairment of cross-link formation. And all of these factors leads to the defective collagen formation, and then we see stretchy skin and loose joints in the case of EDS, and which is commonly known as India rubber man, and sometimes it is seen in the persons who are doing gymnasts and in the circus and all that. Number 2 is osteogenic imperfecta. There is many types of OI. Here is the main important point is brittle bone syndrome, because the bones are very fragile and they can be broken, they can be fractured with even very slightest blow and pressure. Heterogeneous group, the point mutation in the genes of pro-alpha 1 and pro-alpha 2.1. And what happens in the point mutation? The glycine residue is replaced by cysteine, and that leads to the unfolding of triple helix. And that shows in the retarded wound healing, rotated and twisted spine, that leads to the humped back, that is kyphosis. Clinical features: occasional pathological fractures to severe skeletal deformities. Sometimes it is seen that during pregnancy the long bones are fractured, fetal long bones are fractured. Dwarfism, perinatal death, and there is extraskeletal manifestations in the osteogenic imperfecta, that is the blue coloration of sclera, that is due to the stretching of the tissue, which underlying structures are seen, and that reflects the blue coloration. Hearing loss, poor teeth development. Now come to the homocystinuria. That is again genetic defect, accumulation of homocysteine, which reacts with the lysyl aldehydes and blocking the cross-linking of the collagen molecules. And that leads to the skeletal deformities, vascular and ocular defects. Now come to the epidermolysis bullosa. Here the glycosylation of collagen is impaired, and that leads to the characteristic skin blisters, because there is the absence of type 7 collagen, which function as the anchor for fibrils in the dermis and epidermis, at the dermis and epidermis junction, and that leads to the skin blisters. Dermatoparesis, again there is impairment in the removal of the terminal propeptide extension, and that leads to fibrillar impaired fibril formation, and that is the tensile